Hello everyone. Right now we have completed our complete detail about the mechanism of the hearing, cochlear microphonics as well as auditory pathway. Very important for our physiology, for our anatomy, for our ENT and the medicine purpose. So here we have observed that how the sound is converged by our ear, then all the sound is coming through the pinna, then external acoustic meters, then tympanic membrane is vibrating. After this vibration of the tympanic membrane, there is the vibration of malleus, incus and stapes. Then you can see this stapes is connected with the oval window and then cochlea. The cochlear structure we have seen in the previous video. You can refer that video. So what is happening? This stapes is vibrating. So our oval window is getting vibration. There is a to and fro movement. Clinical integration, if there is the fixation of this footplate of the stapes to the oval window, then there is a no vibration, conduction deafness occurs. That disease is our otosclerosis. We will see this topic entirely in our ENT. Okay, there will be the one chapter. अब इसके बाद क्या होगा? Now the impulse is reaching within the our cochlea. So what is happening? See here, in this video we have drawn all the diagrammatic presentation for the mechanism of the hearing. Then we defined and each and every steps we described in a proper way. You can get this complete video. Also we described the impedance matching, which is our viva question, and after that what are the different types of the conduction? Yes, ossicular conduction, then our air conduction and then bone conduction. Three types of the conductions are there. You have to proper know this conduction, otherwise audiometry test in our ENT we will be unable to understand properly. So after this all, yes, we have seen what are the different kind of the movement of the sound within the our internal ear. We have seen the movement of the sound in scala vestibuli and how it is going to the our scala media, then scala our tympani, and when the sound and how the sound is going to the helicotrema, we have seen with the help of this beautiful three-dimensional image. So just to try to understand, in the previous video we have seen the cochlea and the section, so it will appear in such kind of the way. So the center conical part is the modulus, getting the point, around which the cochlea is making 2.5 turn, and when you are making the section, then each part is having the scala, yes, vestibuli, then scala media, then scala tympani. So this is a three-dimensional orientation. Are you getting? Otherwise we will be unable to understand the mechanism. And now the sound is coming from here and it is reaching to the scala vestibuli, then it is doing the vibration. This impulse is making turn around the course and reaching to the helicotrema, and then there is the also vibration of the scala media and our basilar membrane. So the basilar membrane is vibrating. So there is a generation of the traveling wave and there is a concept of the our resonance point. So basilar membrane will carry the impulse again winding around the our cochlear turn, reaching up to the helicotrema, then it will hit and then back again in the basilar membrane. So there is the activation of the resonance point. You can get this all the detailed video, each and every step with the proper notes at the our yes notes. But what I am doing here for the PG entrance exam, for INI CET exam, for the AIIMS, for the PGI, your NIMHANS, your FMGE exams, we are describing in a short and sweet way. So now there is the activation of the our resonance sound. Okay, resonance point. So the basilar membrane is vibrating, and this basilar membrane, yes, over the basilar membrane, the our various cells, rods of the corti, our hair cells, inner hair cells, outer hair cells, they all are vibrating. Over it there is the hair cell is vibrating. Over the hair cell you can see there is the position of the stereocilia, and the longest stereocilia is known as our kinocilia. We studied about it. So there is a movement of this kinocilia. So this stereocilia, kinocilia, they are rubbing over the tectorial membrane. So during this all the condition, there is a generation of the our cochlear microphonics, important for the first year theory, important for our various MCQs. Yes. So what is happening? This cochlear microphonics is just like the receptor potential, which we have studied in the receptor. just like the excitatory post-synaptic potential which we have studied in our sinus part. So all these cochlear microphonics, they are uniting together and then they are generating our action potential. So now the hair cells are producing the action potential, and in the previous videos we have seen that receptor cells, these hair cells, they are giving origin to the cochlear nerve fiber. These cochlear nerve fibers are uniting together and making the cochlear nerve. Now what will happen? Yes, our auditory pathway starts. And how you can remember this auditory pathway? With the trick of the E. colyma. So now the 8th cranial nerve is getting stimulation, E. Then C for cochlear nucleus is getting stimulation, dorsal and the ventral cochlear nucleus. Anatomy integration, we have seen this cochlear nucleus in our anatomy part. Then this cochlear nucleus, they will carry the impulse to our olivary nucleus, inferior olivary nucleus here. Then this olivary nucleus is carrying the impulse to the lateral lemniscus, which is the auditory pathway tract, and then it is carrying the impulse to the our inferior brachium, which is the part of the midbrain. We have seen in the anatomy, not described in the physiology. Okay, and then inferior brachium is attached with the medial geniculate body. Many time asked question. Medial geniculate body is related with the our hearing pathway, while the lateral geniculate body is related with the our visual pathway. Now this medial geniculate body is carrying the impulse to the auditory cortex, that is our area number 41, 42, which is carrying the impulse to the area number 22, which is the audio psychic area. So this is the auditory area, and this is the our secondary auditory area. Primary auditory area 41, 42, that is the our auditosensory area. Then secondary our auditory area, that is audito psychic area. Now we will be able to hear the sound in our area number 41, 42, and we will be able to understand the heard sound in area number 22. So this is complete about our auditory pathway. So you can get this complete video at our app Dr. Shrikant Verma classes. Okay, and here is a free video batch where this all kind of the short and sweet videos you can get, and you can get the various systematically arranged your course. You can get the anatomy course, you can get the physiology course, you can get the biochemistry course at a very nice rate. And also in this Diwali offer, we are going to make very good combo packs of the various subject at a very nominal price for all of you. So stay connected with our app. Thank you very much. All the best for your preparations.